Diabetes doesn't take a break when the sun goes down. And in fact, some of the most important signs of the condition show up while you're sleeping. In this video, we will reveal 12 nighttime signs of diabetes that could be warning you something's off. From restless nights to waking up drenched in sweat or running to the bathroom multiple times, your body might be trying to tell you something, and these signs are too important to ignore. You might think diabetes only affects your blood sugar during the day, but the truth is, it can mess with your body all night long. If you've been feeling unusually tired in the mornings or waking up with strange symptoms, these could be clues that your blood sugar is out of control. And the scariest part, you might not even realize these are signs of diabetes. That's why it's so important to know exactly what to watch out for. So stick around as we dive into these 12 critical signs. Some might surprise you, but they could be key to catching diabetes early and managing it before it takes a toll on your health. Don't miss this important breakdown that could help you catch these signs before they turn into something more serious. Now, without any further ado, let's get started. Number 1. Frequent urination. One of the hallmark symptoms of diabetes, particularly type 2 diabetes, is frequent urination. Frequent urination is known as nocturia when it occurs at night. This happens because high blood glucose levels cause your kidneys to work harder to remove excess sugar from your blood to the urine. However, the excess sugar attracts water into the urine, which increases the urine amount. As a result, you may find yourself waking up multiple times during the night to urinate. Unfortunately, this can disrupt sleep, leading to fatigue and reduced quality of life. A study published in the journal Diabetes Care investigated the association between diabetes and nocturia. The study found that individuals with diabetes were 2.7 times more likely to experience nocturia compared to non-diabetics. Specifically, 34% of participants with diabetes reported nocturia, compared to 13% without diabetes. Number 2. Excessive thirst. Alongside frequent urination, excessive thirst is another common sign of diabetes. It can even occur as a consequence of frequent urination. You see, as your body loses a lot of fluid through increased urination, it becomes dehydrated. This dehydration is detected by the brain, which triggers thirst in order for the body to replenish the lost fluids. This will make you drink more water, especially at night. And when you drink more water, you'll find yourself urinating more frequently, and the cycle never ends. A study published in the Journal of Clinical Endocrinology and Metabolism explored the relationship between excessive thirst and high blood sugar levels in diabetics. 68% of participants reported excessive thirst, which correlated with episodes of high blood sugar where their blood glucose levels were more than 200 milligrams per deciliter. Number 3. Night sweats. Night sweats can occur as a result of fluctuating blood sugar levels. If blood sugar drops too low, the body may respond with symptoms such as sweating, particularly during sleep. Diabetics who use insulin or certain medications that work by lowering blood sugar levels are more prone to this symptom. Night sweats can be uncomfortable and lead to disrupted sleep, leaving you feeling tired in the morning. A 2015 study published in Diabetes Research and Clinical Practice examined the prevalence of night sweats among diabetics. 45% of the participants experienced night sweats, and it was strongly associated with low sugar levels at night, which occurred in 60% of those reporting this symptom. Number 4. Restless legs syndrome. As you might have guessed from its name, restless legs syndrome is a condition characterized by an irresistible urge to move the legs and is often accompanied by uncomfortable sensations. It can be more pronounced at night when the body is at rest. In addition to that, the nerve damage which occurs as a result of poorly managed diabetes may contribute to or exacerbate restless legs syndrome. This condition makes it difficult to fall asleep or stay asleep, contributing to overall poor sleep quality. In 2017, 2,000 participants with 1,000 diabetic patients and 1,000 non-diabetic controls were assessed for symptoms of restless legs syndrome. The prevalence of restless legs syndrome in diabetic patients was 24%, which is significantly higher compared to the control group, who had a prevalence of 10%. Number 5. Increased hunger. Polyphagia, or excessive hunger, can be another sign of diabetes. At night, despite eating a full meal earlier, you may feel hungry again. This is because the body isn't effectively using glucose for energy, signaling to the brain that it needs more fuel. Moreover, late-night eating due to hunger can lead to weight gain and further exacerbate diabetes symptoms. A 2016 study in the American Journal of Clinical Nutrition examined polyphagia in type 2 diabetes patients. 600 diabetic patients were followed for 1 year, with dietary intake and hunger levels recorded alongside blood glucose measurements. The results showed that 55% of participants experienced frequent hunger pangs. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 6. Fatigue and lethargy. Fatigue is a common symptom of diabetes that is more noticeable at night. One of the negative impacts of high blood sugar levels is that it can interfere with the body's ability to use glucose for energy. Since your body doesn't have the energy it needs to function properly, you will feel persistent tiredness. Additionally, the frequent disruptions in sleep due to other diabetes symptoms can accumulate, resulting in overwhelming fatigue. To examine the relationship between blood glucose control and fatigue in diabetics, 500 type 2 diabetics were tracked for 6 months. 78% of participants with poor blood sugar control reported moderate to severe fatigue, compared to 36% of those with well-controlled blood sugar. Number 7. Blurred vision. Blurred vision can occur when blood sugar levels fluctuate, causing the lenses of the eyes to swell. The main function of the eye lens is to focus the light on specific areas of your eye to allow you to see sharp images. However, when swollen, the light isn't focused properly, resulting in blurred vision. While it can happen at any time, it may become more noticeable at night when trying to read or watch TV in low light. This can make nighttime activities more difficult and can be an early indicator of diabetes-related eye complications. In a study in 2013, 1,000 diabetics were followed and had changes in their vision clarity observed. According to the results, 4% of participants reported episodes of blurred vision during periods of poor blood sugar control. Number 8. Difficulty falling or staying asleep. Insomnia, or difficulty falling or staying asleep, is often associated with diabetes due to the discomfort of other symptoms like frequent urination, night sweats, and neuropathy. High or low blood sugar levels can also disrupt normal sleep patterns. Persistent insomnia can lead to a vicious cycle of sleep deprivation, which worsens blood sugar control and overall health. In a study, out of 3,000 diabetics, 58% of them reported insomnia, compared to 27% of the control group. Number 9. Tingling or numbness. Tingling or numbness in the hands, feet, or legs is often a sign of peripheral neuropathy or peripheral nerve damage. This is an incredibly common complication of diabetes. These sensations of tingling and numbness can become more pronounced at night when lying down, potentially making it difficult to sleep. The Diabetes Control and Complications Trial, published in the New England Journal of Medicine, remains one of the most comprehensive studies on diabetic neuropathy. This study found that 60% of participants with poor blood glucose control developed neuropathy, compared to 15% of those with good control. Number 10. Slow healing of wounds. Do you have wounds that you describe as ancient? This slow healing of wounds can actually be a consequence of uncontrolled diabetes. This is because diabetes can impair the body's ability to heal wounds due to poor circulation and high blood glucose levels. The thing is that these wounds act as an open door for any opportunistic microorganisms, which can lead to infections. The most common area for a diabetic to be wounded is their feet. A study found that wounds took 2.3 times longer to heal in diabetics compared to non-diabetics, with 70% of participants reporting delayed wound healing. Number 11. Frequent yeast infections. High blood sugar levels create an environment conducive to yeast growth, particularly in warm, moist areas of the body. Diabetics, especially women, may experience frequent yeast infections, which can cause itching, discomfort, and discharge. These symptoms can become more noticeable at night. A 2012 study in the Journal of Women's Health focused on the prevalence of yeast infections in women with diabetes. The results revealed that 52% of diabetic women experienced recurrent yeast infections. Number 12. Weight loss or weight gain. First off, unexplained weight loss, despite eating normally or more than usual, can be a sign of diabetes. The reason for this is that the body may start breaking down muscle and fat for energy due to its inability to use glucose properly. Flipping the other side of the coin, some people may gain weight due to increased hunger, as we explained earlier, and subsequent overeating. Weight changes can become more apparent when you're less active at night. So, these were the top 12 nighttime signs of diabetes. Now, we want to hear from you. Have you ever experienced any of these symptoms due to diabetes? How did you deal with them? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.